Welcome to the video tutorial for the Prevention and Management of Diabetes Quality Improvement module. This online tool will assist family physicians and their care teams to execute a systematic quality improvement initiative focused on improving the care provided to patients who are diagnosed or at risk for diabetes. Participants who complete the module will earn 20 Performance Improvement in Practice Continuing Medical Education credits from the American Academy of Family Physicians. Board-certified family physicians will fulfill their Performance Improvement in Practice requirement and receive 20 points from the American Board of Family Medicine toward their continuous certification goal. According to the Centers for Disease Control and Prevention, diabetes is the 7th leading cause of death in the United States. However, it is vastly underreported. In the 2014 National Diabetes Statistics Report, the CDC estimates that over 9% of Americans, or 29.1 million people, have diabetes, but more than a quarter of these people have not been diagnosed. In 2012, there were 1.7 million new cases of diabetes diagnosed in the United States, and there were an estimated 86 million Americans with prediabetes. Now more than ever, family physicians and their care teams need appropriate education and training on how to screen and diagnose patients with prediabetes and diabetes, which will help to decrease the number of patients who go undiagnosed and untreated. This online data management tool will allow physicians the opportunity to identify practice deficiencies, create a plan to implement change, and remeasure to illustrate improved patient health outcomes using the 2016 American Diabetes Association Standards of Medical Care and Diabetes Guidelines for Primary Care Providers. Participants in this module will understand the importance of practice team engagement on improving outcomes for patients with diabetes and prediabetes, determine the gaps in the care given to patients with diabetes, those with prediabetes, and those at risk for diabetes, put interventions into practice, work for improvement in lifestyle, medical therapy, and/or monitoring for patients with diabetes, and demonstrate improvements in patient care as a result of systems changes identified through quality improvement initiatives. This program will guide you through 3 phases to achieve these goals: a pre-assessment phase, including evaluating your current practice's care delivery and selecting a plan for improvement, an action phase, the point at which you put your plan for change into action, and a post-assessment phase, including analysis of data, reflection on successes and challenges incurred, and evaluation of the program. The module will guide you through each of these processes, providing an online data collection mechanism for each phase and links to guidelines, resources, and references throughout. This tutorial will provide an overview of the diabetes module, including a brief summary of each phase to better help you understand the process. Rest assured, each step conforms to requirements set by the American Board of Family Medicine for Family Medicine certification. To access the Prevention and Management of Diabetes Quality Improvement module, visit www.qimodules.org. Once you access the module, you can review introductory information, details on how the module works, as well as sample PDFs of each stage so you can see exactly what you will be asked to complete before you even get started. First, you will review the accreditation statement page and then create your physician profile. This information will be used for future module login. When finished, click Register to begin use of the Prevention and Management of Diabetes Quality Improvement module. Once logged in, you are ready to begin. As mentioned earlier, there are 3 phases involved in the module: the pre-assessment phase, the action phase, and the post-assessment phase. Let's begin with the pre-assessment phase. There are 7 steps involved in the pre-assessment phase of the module: practice assessment, practice data collection, staff survey, chart review, analysis of results, selecting a practice improvement plan, and goal setting. We will review each step in greater detail. Step 1, Practice Assessment. In this section, you will be asked to answer 11 questions that provide insight into your practice's care delivery, decision support, and clinical information system. Step 2, Practice Data Collection. After assessing your practice performance, the next step is to take a snapshot of your practice's diabetic population. If possible, you will answer 2 questions by pulling data from your electronic health record. Step 3, Staff Survey. You'll be asked to survey your staff members about their role in the practice and the delivery of care provided to patients in the prevention and management of diabetes. This step is optional but highly encouraged. Step 4, chart selection and review. This section of the module is designed to walk you through the steps of data collection. The module is designed for primary care physicians and requires a sample of 10 patient charts for review. If you are interested in looking at a special population of your patients, such as minority patients or patients with a high stratification level, then you can use a similar selection process and limit the selection to patients within that special population. You will be reminded of this population selection prior to the post-assessment chart review. For your baseline measurement, you will be asked to select the charts of 10 patients on your individual patient panel for at least 1 calendar year within the age range of 18 to 75 with the diagnosis of diabetes. Each chart review should take approximately 10 to 15 minutes to complete, electronically answering a series of questions designed to capture information specific to the evidence-based performance measures. You do not have to complete all 10 patient charts at one time. You may save your work and come back to finish your chart review at a time of your convenience. The information you enter will be saved. Step 5, interpretation of results. Once you've completed entering the required data, results for each measure or your baseline data will be displayed. This information will help you identify practice gaps and will guide you in selecting the interventions that you would like to focus on to improve care in your practice. Step 6, selection of a pathway and practice interventions. To complete this module, you will need to select one screening intervention and one management intervention to implement into practice. Step 7, goal setting. Once you have identified a screening and management intervention, the module will help you to generate a goal statement and articulate a PDSA cycle, or plan, do, study, act cycle for your intervention strategies. Once the above steps are completed, you are ready to implement your interventions. You will use your determined interventions for a minimum of 3 months and no more than a year, after which you will come back to the module and complete the post-intervention phase to see how your interventions have changed the delivery of care provided to patients and the prevention and management of diabetes. You will receive an email reminder after 3 months encouraging you to complete the last phase of the module. The last phase, or the post-assessment phase, will require you to complete all components in the first stage, except this time, your gap analysis will provide insight not only into your own improvement, but also benchmark your results against your physician peers who have used the module as well. This process is designed to provide outcomes insight after a systematic process change has been implemented. In addition to the steps mentioned previously, you will be asked to complete an evaluation and review your goal statement. We ask that you respond to a quick evaluation to help us better understand your experience. This will assist in improving this and future quality improvement programs. You will also have the chance to review your goal statement and PDSA report, allowing you and your team an opportunity to address the quality improvement process and make changes for long-term implementation. Lastly, you will receive documentation of the credit received for your files. This will complete your participation in the Prevention and Management of Diabetes Quality Improvement module. Your credit will then be submitted by OAFP staff to the American Board of Family Medicine for Family Medicine Certification Credit and the American Academy of Family Physicians for Performance Improvement in Practice CME credit. It is your responsibility to confirm receipt of credit with the AAFP and the ABFM. Please allow at least 2 weeks for your credit to be processed. We hope that once completed, you will find this program helpful to improve the care provided to patients in the prevention and management of diabetes. For more information on commercial support and accreditation details, please visit www.ohioafp.org. Thank you for your interest in OAFP's Prevention and Management of Diabetes Quality Improvement Program. If you have questions or would like additional information, please contact Erin Yeck, the Director of Performance Improvement at eyeck@ohioafp.org or 614-914-5630. Thank you.